Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, certified senior advisor, seniors real estate specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
Welcome back to another Senior Learning Institute educational moment. This is podcast 2 of 5 on Medicare. As we noted in Medicare 101 podcast, navigating Medicare insurance can be challenging. However, it doesn't need to be, thanks to the help of licensed insurance Medicare specialists like Randy Schrupp. This expert insight costs you nothing, so it makes all the sense in the world for you to let them help you. It's free. When you complete this podcast, you'll have a firmer understanding of original Medicare Parts A and B, which is hospital and medical coverage. In podcast 3, we're covering Medicare Part D, the optional drug plan. In podcast 4, we're going to discuss optional Medigap insurance, which is also known as a Medicare supplement policy. And this pays for what Medicare Parts A, B, and D do not. And finally, podcast 5 introduces you to Medicare Advantage plans, which is also known as Part C. So we'll slow it up and we're going to do it over individual podcasts. Randy, please summarize for us what Medicare was designed to do and who can receive it.
Medicare was designed to provide health coverage for retired Americans and also disabled Americans and those who were suffering from end-stage renal disease.
So help us understand then, Randy, the importance of taking advantage of this 6-month open enrollment period that's available to us when we first become eligible for Medicare. And when do we become eligible?
Most people will become eligible for Medicare coverage the month of their 65th birthday. For example, my birthday was September 30th, but I became eligible September 1st. For other people, if they are declared disabled for Social Security disability, once 24 months of that Social Security disability has been served, they become eligible for Medicare Part A and B also. That's the typical format.
Okay, so let's break it up a little bit and share with us then, what is Medicare Part A?
Medicare Part A is termed as hospital coverage, okay? The original law was written to provide coverage when you are admitted to the hospital, and it provides basically subject to a deductible, which is currently $1,408 for each time you go in the hospital. Once that deductible has been paid, Medicare will basically cover everything else that transpires during that hospital benefit period.
So in addition to hospital, I believe skilled care in a nursing home or at home and hospice also qualifies?
That is correct.
Okay. So what does Medicare Part A cost?
Most people receive Medicare Part A because they've worked at least 40 quarters or 10 years and paid Medicare tax during that working period. If that's completed, then they don't owe anything from Medicare Part A. It's provided based on the taxes previously paid.
So, and what happens if you don't qualify under that 10-year rule?
Then they will calculate a cost for you for Medicare Part A. All right. And if you're willing to pay that cost, then you can still basically purchase Part A, and then you still have to move forward with Part B if you want to get complete coverage.
Okay, so though Medicare Part A insurance coverage is free, we still have to pay something out of pocket, which you had mentioned. How do these quote-unquote deductibles work?
Well, the deductible is charged once you go in, and it's one deductible per benefit period. So if you go in the hospital and you are, let's say you had an attack of appendicitis and you have an appendectomy, right? You move in, you pay that first $1,408 deductible, okay, and the rest of the bills get paid. Once you're released, as long as you, the benefit period can be up to 90 days. And if you are readmitted during that 90 days, you don't have to pay a second deductible. But suppose you went into the hospital for your appendectomy, and 60 days later, you now go in because you had a car accident. That car accident is a new benefit period, and now it carries its own $1,408 deductible as well.
Wow. So it sounds like that can start to get a little pricey. So again, if you're readmitted within that 90-day period for the same thing, you've already paid your deductible, but after that 91st day, you're going back in, you're paying that deductible again?
That's correct.
So with Medicare Part A, can I go to any hospital or skilled nursing facility I want?
Yeah, yes, you can. As long as that facility or that provider, the doctor, accepts Medicare and Medicare assignment. But that leaves you pretty much, almost every provider in the country accepts Medicare in some format, because Medicare is the largest bill payer in medical in the United States. So yeah, you can go to any doctor, any hospital, anywhere in the country.
So Medicare, I assume, negotiates a certain payment amount, just like a typical insurance plan would, in terms of what they're going to reimburse the physician's office?
They do indeed, and Medicare gets the biggest discount off of reasonable and customary medical charges in the country. It's about 2/3 discount.
Okay, so to summarize then, Medicare Part A is free to most people. There is a deductible, and it covers skilled care and hospice.
Correct.
All right, so let's move on to Medicare Part B. What is Medicare Part B?
Part B is called medical insurance as compared to hospital insurance. It's designed to cover everything you do as an outpatient. Doctor's visits, if you go in for an MRI, or outpatient surgery when not actually admitted to the hospital. It covers all the other things that other than just being in the hospital.
Chemotherapy, ambulances, that type of thing, medical equipment?
All correct.
Right. What about my prescription drugs?
Those are not covered by original Medicare Part A or B.
All right, so we'll get to that later then.
If they have drugs administered in the hospital, those are covered under Part B.
Okay. Oh, bonus for going to the hospital, right?
Yep.
Okay. Is Part B free as well?
No. Part B carries an annual or a monthly premium, and that premium is income related. The base premium currently is $144.50 per month, and normally they will take that out of your Social Security unless you have Medicare but aren't drawing Social Security, in which case they will bill you quarterly. Now, if your income exceeds $85,000 per individual or $175,000 per couple, then they have an income-related adjustment that goes up in steps as your income increases from there. So the concept is they want people who make and earn a lot more money to pay a bit more for their Medicare Part B.
So I can take Part A if I want, because that's free, but I don't need to take B unless I want to, right?
That is correct.
Is there a penalty for not taking Part B?
There is. When you first turn 65 or become eligible for Medicare, it is assumed that you will enroll. If you do not, and you do not have what we call other creditable coverage, meaning coverage that's as good or better than Medicare, then when you do finally decide to enroll in Medicare, there is a Part B late enrollment premium that is 10% of the standard premium. In the example I gave you, suppose you turned 65 and for 6 months you didn't take Medicare Part B, and in a year after you turn 65, on your 66th birthday, now you want Medicare Part B. Well, now you're going to be assessed 10% penalty for the rest of your life for not enrolling when you first became eligible. The way to avoid that is if you have other creditable coverage, like through an employer plan. If you work past 65, 90 99% of the time, those plans are other creditable coverage, so you don't incur a penalty because you didn't enroll in Medicare when you first became 65.
All right, so let's say I'm on my spouse's plan, I'm eligible for Medicare, and I choose not to take Part B. Do I automatically get Part A, and do I check that box that says I have additional insurance?
Yes, you do.
All right, so then who do they bill? Are they billing my spouse's insurance plan that I'm covered under as my primary, or are they first billing Medicare?
The other plan, Medicare pays second in all of those situations. So your spouse's plan would be billed first.
And 9 times out of 10, if they're billing my spouse's plan, is Medicare actually going to end up being billed?
No.
Okay. What you had mentioned that if I'm taking Medicare Part B, it's typically taking out of my Social Security check. What if I'm not taking Social Security yet?
Well, then they will bill you quarterly for whatever your premium is. So if you have the standard premium of $144 per month, they're going to bill you each quarter about $450 a quarter during the year for your Part B. That's what I did the first year I was eligible for Medicare. Paid my premium separately on a quarterly basis.
Okay. All right. So far, I'm taking Medicare, I'm getting Part A, it doesn't cost me anything, but there's a deductible. Then I decide I'm going to take Medicare Part B. There's a monthly premium of $144.50. So let's take this one step further. In addition to that monthly Part B premium, we're also required to pay a deductible for Part B as well. Tell us about that.
That's currently about $185 one time annually for Part B, okay, as a Part B deductible. So it's not a massive amount, but if you started on Part B effective July the 1st, you would have to pay the first $185 of any outpatient services you had to satisfy that Part B deductible, and then all services subsequently would be eligible to the other cost-sharing mechanisms that you have in Part B.
Wow, so that it seems just like a pittance that deductible is.
It is a pittance.
Wow, you think they just roll that into the monthly premiums and be done with it? But
well, it's kind of astonishing. They've been kind of fixated on the whole concept in Medicare was that they wanted all of us beneficiaries to have skin in the game when we receive treatment. So if someone's fairly healthy and they just simply wanted to make sure that we would give some thought before we just went out and took a bunch of services that may or may not have been necessary. So the concept was that deductible would encourage us to be judicious and consumers of medical services, that we got some skin in the game.
Right, and it's the old 80-20 rule, right? They originally pay 80% of what is negotiated, and then we're paying the 20%, and then once we cap out, then we no longer are responsible for that 20% any longer.
That can be, let me give you an example. If you go in for a colonoscopy, it's usually you'll get a reasonable and customary charge on the bill that you see for that colonoscopy of about $4,500. Medicare allowable charge for that service is usually about 1/3 of reasonable and customary charge. So that's down to $1,500. You basically pay 20% of the $1,500 and Medicare pays the rest, and that satisfies the bill.
Got it. All right, so I understand. So there is some exposure to out-of-pocket expenses with Medicare Part A and Part B.
That is correct, and there is no limit. Never, in all the times they looked at the Medicare law, did they want to put what we refer to as a MOOP, a maximum out-of-pocket, into the legislation, so that if you end up going into the hospital 4 different times for 4 different medical conditions over the course of the year, you're going to have 4 different deductibles under Part A of $1,408. All right, under Part B, if you're taking and all you have is Part B and you're on chemotherapy, and that chemotherapy, even at the Medicare allowable charge, bills out at $1,200 per instance, okay, you're going to owe 20% of that. each time you go in. So there's no cap on your personal out-of-pocket expending in original Part A and Part B. That is the reason that people sought additional coverage through Medigap or Medicare supplement policies.
All right, and that's something that we're going to talk about down
Another
the road.
day.
So,
Yeah.
yeah, all right, so that's great. So we won't get that deep into it then. All right, so let's wrap it up on Medicare Part A and Part B. So Medicare Part A coverage is free, and it's available to most, and is for skilled care in a hospital, nursing home, or our home, and we do end up sharing some of the costs with the government. Medicare Part B covers doctors' visits and generally care not covered under Part A, and then we share some of that cost in the form of a 20% copayment at time of service. And lastly, there is no limit to the out-of-pocket exposure, so that's why in podcast number 4, we're going to address how to circumvent that through the purchase of Medigap supplement policy. So we'll talk about that. What's also not covered in Part A and Part B, which we talked about early off, is prescription drug coverage, and that's something we'll discuss in podcast number 3 in this series. Well, Randy, thank you so much for your insight. If someone wants to speak with you in person about this, what's the best way for them to get in touch with you?
They can either contact me by phone at 314-496-0140, or my email is randy_Schrupp@msn.com.
Thanks again for listening to this Senior Learning Institute educational moment. At the Senior Learning Institute, we strive to provide straightforward and unbiased information, the information you need to make smart decisions the first time. Our goal is to connect older adults and their advocates to the resources they need, from staying put to selling your home in any condition, estate and financial planning, care management, care providers, estate sales, clean out services, you name it, anywhere in the U.S. For more information, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute.